Welcome to InfoT. Today we will talk about the pediatric occupational therapy. Pediatric occupational therapy promotes children's participation and engagement in their daily occupational roles. Children need to be independent, productive, and participate in play activities. Pediatric occupational therapists work with children in various settings using holistic, client and family-centered practices. According to a recent research, pediatric occupational therapists usually work with children with all these diagnoses. Most common cases that pediatric occupational therapists are working with are children with ADHD, autism, cerebral palsy, and Down syndrome. Do you know where pediatric occupational therapists can work? Pediatric occupational therapists can work with infants, toddlers, children, and teenagers in all kinds of different settings. Starting from the very beginning of life, as pediatric occupational therapists, we can work with newborn and preterm babies. Our work is crucial for their life and development. What can an occupational therapist do with preterm babies? In the NYCU, occupational therapists can provide services to a high-risk population and medically fragile babies. In most cases, preterm babies are having difficulty developing and maintaining new skills in their early life. There is also a great chance that many more difficulties will come later in their life, always depending on how prematurely they were born. Occupational therapy's role in the NYCU is to promote the baby's development by engaging them in appropriate developmental occupations. The occupational therapist works with the newborn, the activities, and the valued occupations. They enhance the baby's sensory interaction and promote the participation of the caregivers in the creation of routines and habits for their babies. In general, the role of the pediatric occupational therapist in the NYCU is usually to make adjustments while receiving medical care, to support self-regulation during rest and sleep and medical care, to provide the baby with appropriate sensory experiences, to make adjustments to the unit, to provide appropriate sensory motor experiences. The occupational therapist's priority is to reduce sensory stimuli rather than providing them as we do at older children. Premature babies still have a very immature brain and often cannot handle multisensory environments like the NYCU, and they are creating inappropriate synapses. In addition, training the parents and caregivers is a priority for the occupational therapist, both while the babies are in the NYCU and after they take the babies home. The topics we usually educate parents on are the baby's sensory processing skills, social emotional development, feeding issues, motor development, cognitive and play skills. After the discharge from the NYCU, either due to prematurity or other disorders that we mentioned earlier, the occupational therapist continues to intervene in infants and toddlers from birth to 5 years old. This intervention is called early intervention. At this age, the plasticity of the brain is greater, and we see an immediate change in the child. The more positive experiences a child has at the beginning of their life, the more their brain, health, and overall development are strengthened. Young children with disorders usually have difficulty participating in everyday activities. For example, there may be difficulty feeding, dressing, or doing a puzzle. They may have difficulty communicating, sharing, and playing a game with someone else. Parents themselves may find it difficult to go shopping or do laundry. Teachers may also struggle to get the child to eat, stay at circle time, or play in the garden. From all of this, the role of the occupational therapists in early intervention emerges to help children with disorders and their immediate social or other environment. Pediatric occupational therapists promote the functionality and participation of infants and their families in daily routines in all occupational areas such as ADLs, rest and sleep, play and education, and social participation. The occupational therapist works with the child and the parent, the environment and the activity to find the optimal fit between them all. Some of the goals of early intervention are encouraging the bond between the infant and the parent, informing and educating the family, enhancing the child's development and participation in family routines through the use of play and adaptation of the environment or activity. Early intervention takes place in a variety of ways, either on an individual level, therapist and child, or the therapist with the child and parents, or just the therapist providing education to the parents. Furthermore, the intervention can take place in the child's natural environment, at home, in an early intervention center, in the school context, or in the community, for example in a playground. In early intervention, we often use theories of motor learning and motor control, the sensory approach, behavioral techniques, attachment theory, and the systems approach, among others. Moving on from the young children to school-aged, the intervention of the pediatric occupational therapist might also be needed. School occupational therapy usually concerns specific skills around the educational process. The role of the occupational therapist is to help children with difficulties to participate and integrate into mainstream education. The occupational therapist supports children so that they gain the most from their education and participate effectively and meaningfully in activities with other typically developing children. The occupational therapist evaluates the student's capabilities and difficulties, recognizes the obstacle in the occupational performance, the learning process, the routines, and the educational environment. Elementary school children may present difficulties in writing, in using scissors, and others. We also see children who present difficulties in sensory regulation and/or behavior. Usually, we provide support in academic, social, and extracurricular activities as well as in ADLs. Students are often asked to do their homework, socialize and participate in sports activities. That's where the need for occupational therapy comes from. The occupational therapist, focusing on the student and taking into account the school environment, collaborates with the teacher and the parent in order to achieve the work that the child needs, wants, or has to do. Intervention in school occupational therapy can be done in two ways. Either the therapist takes the child out of class and gives him one-on-one therapy, the so-called pull-out therapy, or through intervention in the child's natural environment known as the pull-in therapy. Recent research strongly supports providing therapy in the classroom or in another natural setting. Typically, we work on strengthening basic executive skills, organizational and regulatory skills, fine motor skills, and behavior. In summary, pediatric occupational therapists can work in the NYCU, in school settings, in hospitals, at home, or in early intervention centers with children of all ages. All information in this video was found here. Thank you for watching InfoT. If you like this video, feel free to like and subscribe. Stay tuned for more.